my windshield survey, I observed a lot of things that I did not know about the town. First off, the roads are primarily single lane and very winding. I mean, a lot of curves in the roads. There's little to no sidewalks, no bike lanes. So as mentioned, transportation is a little tough up there. And there appear to be a lot of smokers. Just about every convenience store or gas station I drove by, you'll find several people who are smoking. So there's definitely a need for education there. The houses were very big, yards are very big, very open field. The neighbors are not right on top of each other like you see in the cities. There were there were nearly no police cars around. Granted, it was Thanksgiving weekend, but I didn't pass a single cop car up there. But it is a beautiful land, beautiful parks, lots of parks, Kilgore Falls, Rock State Park, Falling Branch, etc. Very beautiful land. This is a picture I took during my windshield survey of my girlfriend and I. As mentioned, that was my first time in Tazewell, Maryland, so we wanted to show me Rock State Park, which is a very beautiful sight. You climb up a lot of mountains, like 30 feet tall. Top of the city, Hounsville, Maryland itself did not have an annual report, which is expected as that town is so tiny. So instead, I was able to find an annual report on Harford County itself. And some of the goals of the county is to provide a work environment that promotes excellence. That's the number one goal. The second goal is to provide customers with services that are effective, accessible, and customer focused. Goal number three, to provide family focused services that enhance the well being of children, adults, and families by preventing crisis, ensuring safety, increasing self sufficiency, and increasing family stability. I was able to find that on Harford County's website. The county's plan is to focus and takes into account communities' problem, population, and also social system. The environment is a must for the county. So number one goal, mention the environment, but I think they could talk about it more in terms of pollution. Nursing diagnosis and goals. So as you can see from this graph, the number one cause of death in Harford County in 2009 was heart disease, the second one is cancer, kidney stone, fourth is COPD, all of which are directly related to smoking. The top priority for the county in Towson is to improve emergency diagnosis, system, assess healthcare services, and increase transportation. Further, Harford County ranks as the second highest in deaths attributed to emergency cause based on the African American population and Hispanic population. So, heart disease rates was high in Harford County. Diagnosis and goals continue. COPD death rates in Harford County, as we talk about, was higher in Harford County than in Maryland due to the fact that higher percentage of the population in Harford County smoked compared to overall of Maryland. I think the statistic was 17% of Maryland smoked, whereas in Harford County it was around 21%. According to the CDC, smoking is the leading cause of preventable death worldwide. Smoking, as we know, is a major risk factor for both heart disease, lung cancer, and COPD, which are all the leading causes of death in Harford County and Tazewell, Maryland. So that's something the county definitely has to address and taken care of. Diagnosis and goals continue. COPD death rates in Harford County, as we talked about, was higher in Harford County than Nursing diagnosis number one. Nursing diagnosis number one is risk for respiratory illness related to lack of education as evidenced by higher heart disease and cancer rates. So as we talked about in the previous slides, Harford County in Tazewell, Maryland has a higher heart disease and cancer rates than that of Maryland, and it's primarily related to the higher smoking rates there. The objective is to reduce the initiation of tobacco use among children, adolescents, and young adults. Recommendation: educate adolescents, young adults, adults alike, and teach them to understand the link between cancer, COPD, heart disease, and smoking. We know as nurses that there is a direct correlation between smoking and those diseases. We gotta make sure those residents also understand that so they can make better decisions like quitting smoking. Nursing diagnosis number two, risk for altered health, maintenance, and community engagement related to inadequate balance of needs of pedestrian, bicyclists, transit users, and automobiles. So as we talk about the county slash city, especially this town, has a very poor transportation system which needs to be addressed and improved. So the objective will be to work with the local transit, MTA, Maryland Transportation Association, to adjust routes so residents of Powellsville have better access to public transportation. Recommendations: educate residents on bus schedule, routes, stops, and local transit, as well as teach them how carpool can be beneficial. Just because you don't have transportation, if you can find a safe carpool, you can get to destination. You can see a doctor more frequently. Since just about all the healthcare services are in Bel Air, Maryland, all the people obviously are going there. So teaching the community about the benefits of carpooling. Diagnosis number three, which is a risk for respiratory illness related to lack of education as evidenced by heart disease, higher cancer rates, COPD. So once again, we want to reduce the initiation of tobacco use in kids. It starts with kids, especially in high school and middle school. I know that because I'm a young adult. Although I've never smoked, but I see it a lot in the middle schooler and high schoolers. We need to tackle it before they become adults. Recommendation: teaching these kids that about COPD, heart disease, and cancer, showing them, PowerPoints, videos of the lungs, or bringing an actual lung, from somebody who's dead, comparing a healthy lung to a bad lung, so they can really see what they are doing to themselves, so it can teach them to quit or just not start at all. Conclusion: although Powellsville, Maryland is a small rural town, it's very similar to a lot of cities and big towns. It has its list of problems, all of which need to be addressed and require intervention. The pollution is high, which the county and state needs to address. The primary killer of residents are preventable things such as cancer, heart disease, get my sources from.